New rules for para-veterinary professions have recently been announced. Now, role players say that this may increase access to primary animal health care, especially for our small-scale farmers. And it's my privilege to welcome today Dr. Nandipha Ndudane. Am I correct with that?
Yes, Lisa, you're correct.
Welcome.
But you can call me Toyota because that is the name that I go about.
Oh, good.
Yes.
Well, Toyota, welcome. Briefly explain to us what these new rules entail.
Hello, Lisa, and thank you for having me here today. The new regulations and rules are regarding the para-veterinary professionals. Let me first quickly explain what are those. The rules are regarding the nurses, veterinary nurses, the animal health technicians, vet technologists, and the veterinary physiotherapist. We call those the para-veterinary professionals. So the new rules have come into place to prescribe the scope of practice for them, and we have revised some areas where there was a need to revise.
Mm-hmm. What led to this decision?
This decision, Lisa, is influenced by many factors. One, the socioeconomics out there and the issue that we keep on having many graduates that are unemployed, that are waiting on government to be the source of employment, and this could not be so. And benchmarking with other countries, the para-vet in other countries are able to work on their own. So these new rules are actually allowing these para-vet professionals to a limited extent have their own private practice or private facilities, and the name of the facility will be dependent on the category. For instance, for animal health technician, we'll call it a primary animal care facility. Mm-hmm. So for a limited areas that have been identified within the scope of an animal health technician, that technician is allowed to open own facility and run that practice without the direct or indirect supervision of a veterinarian for those prescribed areas. And then there are still areas where that technician has to work with a veterinarian.
Who will benefit the most?
I think it's firstly the rural farmers. The rural farmers for us, because as you are aware, we talk of veterinarians being a scarce skill, and the impact that is felt mainly in the rural areas where there is scarcely no private vet, and even the state now, we find that the high vacancy is high and the turnover of veterinarians trying to move into the urban area is high. So the rural livestock farmer is left without having access to very much needed veterinary care for the animals. So it's the rural farmer, it's the animal, because the animal is going to get much needed attention and welfare, focus and informed treatment by a qualified personnel. And then again, talking about unemployment, the youth unemployment rate in South Africa is also high. So the para-vets also, those that were waiting on government to get employment and are not getting employed, now understand that there is a scope for them to work on their own. So also the para-vets are going to benefit.
Toyota, how will this practical work on a practical level? And may I add, how long is this going to take?
Firstly, this new rule just came into effect for the animal health and the veterinary nurses and the vet techs. They came into effect in December last year. For veterinary physiotherapists, they just came into effect in February this year. So they are still new. What are we doing as the South African Veterinary Council? We are now making sure that people know about this. The para-vets and the veterinarians, they know about this. We are having webinars. We are here today talking about this, and we are making sure everybody understands what this rules means for each professional, para-professional, because there's worry out there that people are going to be encroaching. So what it means in practice, if I use the veterinary nurse has a defined scope of practice, which is described and prescribed by the South African Veterinary Council. That has not changed. What has changed now is what can they do on their own. Similarly, with the animal health technician, they have a prescribed scope of practice, which says an animal health technician does 1, 2, 3. And that has also not changed. What has changed within there are the services that they can do on their own and the fact that they can work for own gain. That is what has changed. So there is not going to be somebody now doing a work of another professional in here. There is slight overlap somewhere, which has always been there, but we are going, as SAVC, going to be focusing on our webinars, defining and making sure that people, that is the professionals and the para-professionals, understand this, because we first have to get them to understand in order so that they are able not to be confused with veterinarians out there by the community that they will be servicing.
Are they all trained at Onderste Poort, the people that we're talking about?
Not all of them, yes. Yeah. In South Africa, Onderste Poort is training the veterinarians and the veterinary nurses. Those are the two qualifications that they offer. And then we have the animal health technicians that are offered by 3 institutions. We have Tsolo Agriculture and Rural Development Institute, commonly known as TARDI, and we have UNISA, and we have Northwest University offering the animal health qualification. And then we have Plettenberg Equine Librium College in Plettenberg Bay offering the veterinary physiotherapy qualification. And we have Tshwane University of Technology, TUT, offering the vet technology qualification. So we have many institutions that are offering these qualifications. And yesterday, Lisa, we were having a meeting with the institutions and the issues of these roles and what does it mean and what do the institutions have to do in their curriculum. Because remember, they have never worked on their own. Maybe even the curriculum was not fit for purpose before because they were being trained to work under supervision. So we were talking about this as SAVC. We are busy trying to check and the risk, the gaps, to make sure that this is a success.
So this will have no negative impact on our veterinarians, or actually supports the system?
It should not have, Lisa, but like in any change is not easy for anybody. The concept itself is actually causing people anxiety. We are dealing with that. We are communicating with veterinarians. These rules, before they were passed and sent to the minister to approve, were publicly consulted. The veterinarians were given a space to air their views, and there were good points that they mentioned, but everybody is anxious about protecting own territory. We know it's normal, we are human, but they should not be having, especially if we work together and we make sure. And our focus is actually to train the paravets to be able to run business. That is our focus. In there, we as SAVC, we are working with the Food and Agriculture Organization of United Nations. They are rolling out a pilot program to train 50 unemployed animal health technicians to run a business.
Right.
Yes.
Thank you very much for shedding some light on this topic. Thank you for coming.
It is a difficult topic, but an easy topic. Thank you for having us.
We're looking forward to see what happens in the future. Thank you.
Thank you.
And that's all on the new rules for para-veterinary professions that have recently been announced.